Good evening. I'm Dr. Max Gomez. I am the Senior Health and Medicine Correspondent for CBS here in New York. And it is my pleasure to once again be hosting a webinar here for Columbia Children's Hospital. I will do a little introduction here in a moment. I want to do some housekeeping here first. We are going to introduce our panelists. If our observers have any questions, if you would please put them into the Q&A box, not the chat box, and we will try to answer those as we go along here. And a reminder that this will be video. The video, this is being recorded, and the video will be posted tomorrow on the Columbia Children's Health YouTube channel so that you don't have to take notes. You won't miss anything here. And if I may, you know, this is obviously a very high interest tonight. All sorts of things are going on. In fact, news is breaking even almost as we speak here. You know, there are 28 million US children ages 5 to 11. And the Biden administration said Wednesday today that the United States has acquired enough doses of the Pfizer-BioNTech coronavirus vaccine to immunize all of those kids for free. The government is coordinating with local jurisdictions to distribute pediatric vaccines to more than 25,000 pharmacies, doctors' offices, and other venues. This plan depends, though, of course, on a recommendation from some other federal regulatory agencies, including the CDC, and the Biden administration expects all of that to happen by November. And then also a little bit earlier this afternoon, the FDA approved both the Moderna and the J&J booster shot. So all kinds of stuff is happening here. But to introduce our panelists who are going to explain a little bit more about this as we dig into this, please welcome Dr. Melissa Stockwell.
Thank you so much for the introduction, and thank everyone for joining us today. So I have the pleasure of introducing my colleagues. First, my name is Melissa Saccol. It's nice to meet you. I'm an associate professor of pediatrics and population and family health here at Columbia University Irving Medical Center, and I'm chief of the Division of Child and Adolescent Health. I'm fortunate to have a number of members of, some members of my division and other members who our department who really are the experts in these fields. So first I'm gonna introduce Dr. Steve Caddle. Do you want to give a little wave, Steve? But Steve is assistant professor of pediatrics here also at CIMC. He's a general pediatrician at one of our NewYork-Presbyterian hospital sites, and he does a lot of work with the American Academy of Pediatrics, particularly in its ECHO consortium. So for those of you who have heard of that, these really wonderful weekly telementoring sessions for US-based pediatric providers. Steve has been working tirelessly, has done a number of these, the current ones on infection prevention and control, last year on COVID, and then did a number of them on Zika. So we are so fortunate to have his expertise with us today. Next, we have Dr. Melissa Saiman. She's a professor of pediatrics here in the Division of Pediatric Infectious Diseases. She's also our hospital epidemiologist from Morgan Stanley Children's Hospital, and associate vice chair of faculty development for our Department of Pediatrics, and really is one of the leading experts on infection prevention and control, and has been our go-to person here for all things COVID. So again, thank you so much, Lisa, for joining us. Next, we have Dr. Farooqi, who is an assistant professor of pediatrics, also here in the Division of Pediatric Cardiology, who is an expert in many things, but including using advanced imaging techniques, particularly for children with congenital heart disease, and really has also been very involved in imaging and caring for our children with MSCE. And so we'll be here to answer any cardiology questions that may come up. Finally, last but not least, Dr. Marina Catallozzi, who is associate professor of pediatrics and population and family health. She's also vice chair of education in the Department of Pediatrics, director of our pediatric medical student education, and newly, as of just a short while ago, is vice president of health and wellness and chief health officer at Barnard College, and is also a specialist in adolescent medicine. And so we'll be able to answer any questions about that. But I we'll pass it off to Max, or we can get going answering your questions.
Great, thank you. Thank you, Melissa. By the way, I have encouraged, or I have asked the permission of all of our panelists to address them by their first names so that we can be a little less formal and more interactive. And I've also asked them or suggested to them that if any of them have anything that they want to chime in on that somebody else has said, please do. You know, your opinions are welcome across the board here. So let's start out with some basics, I think, here, just to dispel some of the things that we've heard so often here. And that is, do kids get COVID, and how seriously do they get sick with COVID? That's pretty much for any of you, but I don't know if that's, Melissa, is that for you, or who else would like to take a shot at that?
I can start, and my colleagues can chime in. 100% children do get COVID. There's been a number of studies that have shown that, including one that we just took part in that was just published about a week ago. But really, the American Academy of Pediatrics has been tirelessly putting up data weekly to really show all along that kids have been infected with COVID. And in reality, as rates are going down everywhere in a lot of places, children really are becoming, much more of a proportion of the groups who are getting infected. Fortunately, most kids don't get too sick from the infection, but unfortunately, some of them do. We definitely know that children can end up in the emergency room. They can end up in the hospital. They can end up with, which I mentioned, MSCE, the multi-system inflammatory syndrome, and see Caddle and her colleagues in the hospital can have heart effects. And we also know now a little bit more about potentially long-term COVID in kids. And so really the best thing we can do is really avoid children and adults and everyone from being infected.
So let me put it to some of our other panelists here. Even though they do get sick, it is still, am I right in saying, relatively rare and relatively mild? Is that a fair statement? Did I freeze? Or is nobody answering me? It's relatively rare and it's relatively mild. So the question, or the things that I've heard from many parents is, all right, so then why bother getting them vaccinated and take a risk, however small, with a vaccine?
Lisa, do you want to?
Yeah, so I think it's really important to echo what Melissa just said. So just as adults can get sick, can get hospitalized, can go to the intensive care unit, and there are reports of children who died of COVID. So I think we have to remember that just as we've been hearing in adults, children do have that same spectrum of illness from COVID. It is true, Max, that there are fewer cases in children than there have been in adults, but it is not rare. And us here in New York, even from the very first wave, when we started seeing COVID in a year ago, March, we were seeing our hospital had pediatric cases of COVID. And I have a lot of friends all over the country in pediatric infectious diseases, and they have had dozens and dozens and dozens of children hospitalized in intensive care units, and some of whom died. So I think that I'm happy you started with this question, because I think you got at a core misconception that children don't get COVID. Children absolutely get COVID and can get incredibly sick. And I want to underscore two other points that Melissa made. And again, I definitely want our colleagues on the panel to answer this. We are learning still about the long-term consequences. Mm-hmm. And it's very, very hard to know in very young children about some of the long COVID effects that Melissa mentioned, but we do know that those occur. We don't know how frequently, and we don't know how long we might see those effects. So I think that when parents are thinking about all of this, they have to really get a very realistic, honest appraisal of the risk from experts.
And I think it's fair that you said, even if it were relatively rare, if we're talking about 28 million kids just in that one age group, 5 to 11, even a relatively rare percentage still adds up to an awful lot of sick kids, no?
Yeah, and I think just to give you some numbers, there have been over 6 million children in the US who have been infected with COVID, and that's just the ones who were tested. And we know that there are, particularly early in the pandemic, so many children who were sick who weren't tested. And as I mentioned, it's about a quarter of right now the number of positive cases. Every week, about 25% of them are children. And according to the AAP, we've added 1.1 million child cases just in the last 6 weeks. So as things are going down elsewhere, the infections in children, are not going down. And so it really, we can't underscore enough the importance that children really are at risk. I think, wow. Marina, you wanted to add something?
I was just going to add that we think about, even considering mild COVID, where maybe it's like a flu-like illness, we finally are getting kids back to school. So that discontinuity for them, being out of school, the kind of social disconnect, the learning disconnect, the concept, COVID is frightening to have at all, even if it's a mild case. So the burden on those young people, their family, their siblings. So I think we have to think about that. And then I think it's always dangerous when we minimize the health of children in general. And I think it can lead to, saying like, oh, and also I don't have to go back for primary care. And we know that so much was missed during that initial piece of the pandemic. And it's so critical for us to make sure that we are, getting kids immunized against the flu, getting their regular immunizations, their regular healthcare, and also checking in on their mental health. And we want to make sure that we're not missing those opportunities. And I think the messaging that like, oh, kids don't get as sick can be dangerous in that way, no matter what the spectrum is. I think
one other important element, I think, here that we haven't hit on yet, but I want to make sure that we touch upon, is there are a lot of collateral benefits to vaccinating children other than protecting children themselves, right? Nana and Pop-Pop are at risk if the child brings COVID into the household or when they go to visit their grandparents or their parents or whomever else. Is the vaccine then effective against preventing kids from spreading, even if they are either mild cases or asymptomatic?
Lisa, do you want to start with this one, or?
These are all the questions that we have to answer. So as you know, Max, we really have just started having the opportunity to vaccinate young children. So what we should talk about is vaccination in general. And the vaccination in general is absolutely the best, most important way to stop the spread of COVID. And we know that people who get vaccinated are protected against getting infected. And if they do have what's called breakthrough infections, those are generally mild. Very, very few people who get breakthrough infections are people who've been vaccinated. And if you look now in the hospitals around the world, the vast, vast majority of people in the hospital have not been vaccinated. The vast majority of people who are dying now, unfortunately, of COVID have not been vaccinated. So these are preventable deaths, which is just so heartbreaking. So the question you asked was, does vaccination prevent transmission? It absolutely does. We do know that when people do have breakthrough infections, they can transmit to others, but they are infectious for a shorter period of time. So again, you started saying how important vaccination is beyond the child, which we all deeply care about, and that's another very important reason. And I have to underscore what Marina said, which is getting children back to some normalcy after this incredibly disruptive year and a half that they've had.
And we're going to get into some of those mental health issues here a little bit later. But first, I want to talk to Steve, who's been very quiet over there. You've been hiding, but I'm not going to let you hide any longer. So if we vaccinate kids and do a good job of vaccinating kids, we don't have to mask. We don't have to put masks on kids when they go back to school. Yes, no, maybe?
At the moment, the answer for that is no. We know that, kids who are vaccinated, adults who are vaccinated still potentially can get breakthrough infections. And there's a significant proportion of the population and of communities that remain unvaccinated. And so for those reasons, we and the American Academy of Pediatrics and most medical societies do recommend universal masking for kids, especially in schools. We will see and hear about different areas that are, not promoting mask mandates, but at least here in New York City, we are still doing that. And in New York State, we are still doing that. And I think it's very important, not just for protecting the kids themselves and protecting the unvaccinated, but protecting others in the community from this potential spread of COVID, especially since we have variants like we saw with the Delta variant that increased the number of cases, number of hospitalizations, and unfortunately the number of deaths, even as vaccines continue to rise. So,
Kanwal, let me bring you in here for something, because a couple of our panelists mentioned the long-term effects of COVID-19 on young patients. What do we know about that? I know that earlier on, way back at the beginning of this, we did a webinar on MSCE, multi-system inflammatory diseases in kids. Is that what we're talking about, or is it more like long haul syndrome that we've heard so much about in adults?
Thanks for that question. So when I think about COVID infection in children, I kind of separate it into, some of the milder infections that we've been speaking about. And then some children get pretty sick and get a syndrome called MIS-C, which you mentioned, multi-system inflammatory disorder or syndrome in children. From our experience here, we know that those children get very sick, so they need intensive care. In our kind of group of patients that we looked at, up to 75% of them needed ICU care, mainly to support their blood pressure, not necessarily for respiratory support, which is typically what we see in older patients. But certainly those children got very sick. When we checked the hearts of those patients, so we do sonograms of the heart, we found that up to 80% of those children had some abnormality of their heart. So that means their function was compromised, so the heart wasn't squeezing as well. They had some valve leaking. So all signs of inflammation of the heart. Luckily, and something that was reassuring was that these abnormalities resolved pretty early. So within a few weeks after their hospitalization, we found that, the percentage of patients with abnormalities was down to less than 2 patients at 4 to 6 weeks of follow-up. So those abnormalities that we were seeing early on do resolve, but we're still following those patients with MIS-C long-term, because again, this is something that is unknown at this point, and so we're getting cardiac MRIs in our patients who had some form of abnormalities at around 6 months. Findings so far have been reassuring on those MRIs. Now, when we think about the other kind of arm of patients who didn't have MIS-C but had COVID or long COVID or PAS-C, largely we're not finding cardiac manifestations, luckily. A lot of these patients, from the few reports that we've seen, are having, fatigue, difficulty concentrating, some have shortness of breath. And so we're not finding cardiac abnormalities, luckily. But again, we're still learning about what longer term kind of limitations we might find in these patients.
So in that case, it does really more closely resemble long haul syndrome, for lack of a better term, in adults than
Yes.
it does this MIS-C that we have that we've heard about, right?
Exactly. Yep.
Yeah. And as far as we know, any treatment or therapy that helps with this so-called long haul syndrome?
I think we have to work on kind of characterizing it first. I know that there are some studies. There's an NIH funded recovery study that's looking at characterizing these abnormalities. And so I think once we characterize them, then we can look more into specific therapies for those abnormalities.
But nothing we can put our fingers on yet.
Yeah, but a huge amount of work, as Caddle said, is this is an area of just so much importance because, you know, we really don't even know the proportion of people that are affected and how long it's going to last. And we are having a lot of reports of how debilitating it can be. The reports are more common in adults, but as more and more children get infected, as Melissa said, we have to be very concerned about that possibility.
Right, right.
And I think just to add just one more aspect that, you know, people are interested in following over time is the kind of cognitive developmental aspect for kids. And you know, we definitely know that in adults there's, you know, questions of kind of brain fog and, you know, other sort of things, and what does that look like in kids, and what does that mean long term? And I think we need to know more about that. And also, I think going back to Marina said, there's also the being out of school, right? If you're a child or adolescent who has long COVID and you're missing lots of school because you have such fatigue and the things that Caddle talked about and aren't able to go to school, you know, that has a long-term impact as well. And we're just going to start to begin to understand all of that.
Right. So I want to get back to the vaccine in a little bit, but since you teed it up here for Marina, let's talk about mental health aspects here, developmental issues for kids either with COVID or being out of school if they're not vaccinated.
Right. And I think this is critical, and it's been out in the lay press a lot. And I think more importantly, families, kids themselves have been noticing it. And I can give you some numbers. The Morgan Stanley Alliance for it's the Morgan Stanley Alliance for, I want to make sure I get it, Children's Mental Health has a great website, and they actually did a nationally representative survey. If you look, there are about a third of teens who are surveyed there who said that they definitely had worsened mental health over the pandemic. And this is in teens in particular. And it's largely, we're looking at things like depression, anxiety, worries, a lot of worries about reemerging, sort of going back to school, social anxiety, things like that. The positive, the upside here is that more young people talked about 42% said they have more conversations about their mental health. So we're starting to destigmatize, which is great. And 2/3 felt they were hopeful that they would adapt and rebound. So I think the kind of the silver lining I try to see here is that we are talking more about mental health and increasing our acceptance, hopefully, and destigmatizing. The downside is that we had mental health access issues prior to the pandemic, and it is really critical that we, utilize all of the services that we can in school now with your physician's offices, and also try to give families and educators and anybody who has contact with kids a recognition of what to look for. Really making sure to give stability, right? Maintain a routine for kids. Encourage them to express themselves. Give them real, accurate information. And the CDC has some really wonderful resources, as does this alliance. And just be aware, right? So if you see that your young person is avoiding school, not wanting to go in, not connecting with others, seems more anxious, really focused on COVID, that's a concern. I think your concerns about development are real. Again, I can't stress enough this idea of getting kids to their regular appointments because, again, completely depending on families to recognize those things can be really difficult, particularly when we're not having as much social engagement. So, being able to get EI services now in schools again, early intervention services, really important. And again, I think that, I think a lot of people have fears about, what if they're not seeing faces because masks are being worn? Again, just giving families as much information as we can about how you can interact with your kids, how you can give them more, other cues. Again, there's a lot of really nice resources on the CDC website. And I think showing that to families, making sure that they feel engaged and that they feel empowered to recognize when their child isn't doing well, and that it's okay to ask about it. I mean, it shouldn't be a taboo subject. And the more that families can talk about their own health, mental health, wellness, and model it for their kids, the better. So lots of information there, but I think that support, that structure is critical.
So you talked about a lot of resources, and you said we have a somewhat of a silver lining. But if I understand it correctly, the genesis, if you will, of some of these issues is the isolation. The kids have not been socializing. They haven't been in school. They haven't been around some of their peers, never mind their siblings, but some of their, their peers.
I think it's multifactorial. I mean, I think that young people find ways to connect, and anybody who has a teenager in their life knows that TikTok is like a really incredible way for young people to communicate with each other. I think, though, the idea of, there's just so much, and there's a lot of intersectional issues, and for families who had a loss, or for kids whose parents were working in the front line, perhaps in grocery stores, who felt worried about their family member every day. The idea that it's really frightening to not have a lot of information or control over the world. And then for 5 to 11-year-olds who may be the only person in their family who's not vaccinated, right, and feel that somewhat vulnerable. So I think it's really multifactorial. I think the social piece is definitely there. The idea of people missing their major life events. If you look at some of the sophomores in college who, didn't get to graduate, they didn't get their first year of college, now they're coming into sophomore year of college. Same with, a middle school, now you're in 8th grade and you missed the first 2 years of middle school. So I think there's a lot of worries that usual interaction, decision-making you have around, how you handle a friendship group, those sorts of things. I think it's just a lot for kids. And I think parents checking in and saying like, hey, are you okay? This is a lot today. And you have to wear a mask, and we recognize that, and taking time over the weekend to make sure they get to process some of that. All of this is really, we're going at such a fast rate with so many of these changes. I know it feels slow, but just remembering to check in with these young people who just haven't had as much life experience to know about how to cope with these changes.
But would it be fair to say that the first step in remedying this, it's not the only step, but the first step in remedying this is getting kids back into school?
I think being in school is critical, right? And I think one of the things, one of the ways you avoid, if we think about post-traumatic growth rather than post-traumatic stress disorder, is that you have social connection, right? Social connection and support is key. And so, and having other adults in their life who care about them, the teachers, absolutely. I think getting us back into a rhythm without ignoring what's happened, right? So being able to do both, right? To hold what stresses have happened, and acknowledge them, manage them if they need to be managed with therapy or other services, but also to help support them in moving forward and getting back to some semblance of those normal school interactions.
And if I could just add to that, Max,
please, yes.
I think, throughout the pandemic, we've learned a lot about, the negative impacts of school closures, and the social and emotional deficit of, transitioning in and out of school, of isolation. There's a number of things that are absent in families' lives for kids who are not in school or not in childcare programs. It's an added burden to families who need to work. Kids don't have access to school lunch programs, but that was sort of remedied a little bit during the pandemic by adding back school lunch programs, even for kids who were not in school. Behavioral health monitoring, as I think Marina touched on, is one of the aspects of being able to go to school every day and having teachers and guidance counselors talk to you and see what's going on. Throughout the pandemic, we saw a decrease in the number of reports of child abuse and neglect, partly because teachers and school employees are mandated reporters for child abuse. And so we saw a decrease in that, even though we sort of knew that things were actually happening. And just this week, actually, the AAP and the American Academy of Child and Adolescent Psychiatry, as well as the Children's Hospital Association, declared a national emergency on children's mental health because of everything that we've seen that has gone on through the pandemic. And even as schools have reopened, there's still an overwhelming burden on children and families. There was a recent CDC study that showed that there was an increase in emergency department visits for mental health emergencies for children from 5 to 11. I think there was like a 25% increase, and for kids 12 to 17, maybe a 30% increase. So we know that there's an overwhelming burden. Part of that is isolation. Part of that is, as Marina pointed out, the loss of maybe a loved one or a caregiver to COVID. A couple of weeks ago, the New York Times reported that there were over 140,000 US children who had lost a primary or secondary caregiver. And that is overwhelming to families. And so, I think there's a number of reasons. It is multifactorial, what is happening in regards to mental health. And because of that declaration of the emergency this week, I think, one of the things that's going to come out of that is perhaps an increase or a request for increase in support and funding for things that support children and communities as far as mental health goes.
All right, well said. I think the part here that a lot of people have questions about now, let's dig into the vaccine and some of the details here about the vaccine. My understanding is that all of the vaccines that have been ordered particularly for this age group, kids 5 to 11, will be smaller doses and shorter needles. Will that make much of a difference? I guess psychologically.
Yeah. So I think we're all very excited that it's sort of right on the cusp and the horizon of having approval for vaccination for the 5 to 11-year-old group. So just to kind of give people the timeline of that, the FDA it's going to be talking about it next week. All signs seem to be good for approval. Again, they're going to do their due diligence. They've been really studying this and the data very carefully. If they do go ahead and approve it, then the CDC's advisory committee will then meet early November 2nd, 3rd. They then approve it. Then the Department of Health or Health of all the kind of cities and states are ready to ship it. In fact, New York City Department of Health and Mental Hygiene opened up their pre-ordering yesterday. So I would say people are able to go in and register is through the city invitation registry and the general kind of mechanism they do for sending VFC and COVID vaccine. I can say that I've had a lot of vaccination, kind of joys over the past year. I think, myself being vaccinated, my family, my friends, my kids, and yesterday being able to put in that pre-order for 5 to 11 was actually a very meaningful moment for me and my colleagues, because I think it is a real turning point. In terms of your question, the dose, the Pfizer dose is smaller in kids. So they basically, when they did the trial, they looked at what was the different kind of doses to be able to get the immune response that they needed. So this dose is about 1/3 of the dose that we have in adults. And so for those who are pediatricians, the vial is going to be orange, so it will actually look different. So you'll be able to keep it separate, easily separate. It's also refrigerator stable for 10 weeks, which is a game changer for being able to have it in pediatricians' offices and family medicine doctors' offices. And that I think really is going to be so important. in addition to being able to get it at pharmacies and Department of Health sites and all those other things. The needles are shorter. We always use shorter needles based on age. And so everything is really the dose, the needle, everything is age appropriate. We're all ready to go as soon as we have the approvals.
So Melissa, one of the other things that I understand is that a lot of the focus for vaccination is going to be on the so-called medical home for kids, which is pediatricians' offices, that this is a place they're used to going to. They're not going to the Javits Center, for example, where you've got, a very scary place to go in and get a shot, even for adults. So the pediatrician's office is a place that they are used to going to get vaccines and so forth. Is that also valuable? And both, I guess, maybe also from the point of view of their mental health, but also maybe we ought to talk about this. Kids can't decide for themselves, I want to get a vaccine. What we really need to do here is convince parents.
Yeah.
How do we do that?
Sure. So I think to start with the first part, we have a multi-pronged approach. So certainly getting vaccinated in your medical home, also vaccinations at pharmacies. It's a lot of kind of the major medical pharmacies and a lot of other ones. That's really important because not everyone has a medical home, not everyone has access to a medical home, and so we really do need to make sure, from a health equity perspective, that we have multiple places for kids to be able to get vaccinated. Department of Health will also be offering vaccine as well. So I generally say the best place to be vaccinated is the place that has the vaccine for you on the day that you want it. And really it is completely fine to get vaccinated at your doctor, at the pharmacy, Department of Health site. All of those places are equally as good to get vaccinated. I think in terms of your question for parents, just to echo, I think something that I believe Lisa's the one who said this, that vaccination is probably the single most important thing that we can do right now. And I truly believe that in general, but very specifically for COVID as well. It really is the best way to protect our children and protect our families. You mentioned also the added benefit of protecting other people in the household, but really for protecting the children themselves, having them getting back to a more normal life, being in school, and really a way that we can decrease COVID in the community, and then protect them and their long-term health as we talked about. I think the best thing for parents, and I know that Steve has these conversations probably daily, with his patients, is really to answer questions. I think parents are, really want to do right by their child, and they're just trying to, figure out what's the right information. There's so much misinformation and disinformation out there. And so I think talking to your child's doctor, your pediatrician, listening to the Department of Health, the CDC, hopefully listening to us, and really getting the right information, really, and how important it is, and how safe it is to really get your child vaccinated, and having those conversations.
Lisa, what are these vaccines going to do about Delta variants?
Great question, of course, and on all of our minds. And the great news is that the vaccines are effective against the Delta variant, which is so important. As we've said, that this variant, I think Steve mentioned this, is more transmissible and can cause more severe disease. So it's just such a great tool to have in our toolbox. And I just want to say that, although we're focusing on the 5 to 11-year-old in terms of giving information, healthcare providers have been doing this work now for a very, very long time, since the vaccines were originally authorized. We've been doing it with our colleagues. We've been involved in the older age groups. We've been doing it with our friends and families. So, we have had a lot of practice answering very, very specific questions, and we'll continue to do that. I think it's really important to recognize that it has to be an ongoing conversation where people can ask all of their questions and feel like they're going to be respected for their questions and concerns, because it's obviously a decision that has to be made with a lot of good, solid information.
But let me flip that around a little bit. Kids can't go to school unless they have their measles vaccines, their mumps, their polio, and a whole bunch. Why can't we just do the same thing with this, which certainly is just as difficult and probably at this point more common than some of those other diseases? They may not like it, but why can't we just say, you got to get it? Anybody can jump in on that.
I mean, some schools do have a vaccine mandate for not only faculty and staff, but also for students now for who are 12 and older, and then as the vaccine is approved for younger ages. So there are schools who are doing that because they
but better to persuade,
yeah.
Better to persuade than to force.
No, I think I sometimes yes, I think, but I think also, even for schools that are doing that, it is always paired with lots of information for parents and opportunities to ask questions. I think all my panelists will agree that we've all had those questions with parents, where parents have a lot of questions, and being able to answer those questions, then definitely feel comfortable with getting their child vaccinated. So
Right.
I think those things always in schools and other places do get paired together. And the same, I think, for healthcare institutions too. Really, even when mandates came online, it was really along with lots and lots and lots of support and questions and venues to answer all of those questions and provide trusted information.
So Kanwal, I think Melissa and or Lisa mentioned misinformation. And one of we've gotten a couple of questions here, which I think probably fall into your bailiwick here, about some of these side effects of the vaccine. We're hearing about raising the risk of cardiomyopathy with mRNA vaccines, particularly myocarditis. One questioner said that places in Europe are shying away from recommending some of those. Talk to me about some of those supposed side effects, long-term side effects like myocarditis.
Sure, and that obviously has been a concern for parents who are considering the vaccine. I mean, we're seeing and are seeing some cases of myocarditis associated with the vaccine, specifically the mRNA vaccines. The CDC estimated that, about 1 in 5,000 males with the highest risk of, kids who are between the ages of 12 and 15 years have the risk of 1 in 5,000 of them having a case of myocarditis after this mRNA vaccine. In girls, it's a bit less and less frequent. Now, we're again accumulating information on these patients. Large majority of those cases have been mild. So again, myocarditis is an inflammation of the heart. And so we assess, function of the heart. So how well is it squeezing, and other signs of inflammation that we can see on a sonogram of the heart. But, those patients, as I mentioned, had mild symptoms and were discharged home within a few days and were not found to have any long-term, so far, sequelae of that myocarditis. Now, again, we're weighing that risk with the risk of getting COVID and potentially getting myocarditis from COVID or getting ill from COVID. And so given all of the information that we have, we are still, and the CDC is still recommending, children get these vaccines who are in the eligible age range, because the risk of getting COVID and being very ill is still higher than getting myocarditis from these vaccines. So again, we're still monitoring the situation and collecting data on these patients, but certainly we've kind of established that the risk of getting COVID is higher, and these vaccines are largely, as we know, protective.
And is it more common in teenagers as opposed to this new age group of 5 to 11-year-olds?
So far, that's what we've identified as the younger age range. We'll start getting these vaccines. We'll continue to monitor and see, if we have similar findings in that age range.
We're just to add to that. So Pfizer did, when they're putting the information in for their UA authorization did say that they didn't see myocarditis in the trial in this age group. I just do want to point out something really important that Caddle said, which is you can get myocarditis from COVID infection itself. In fact, it's a known outcome of COVID. And in general, and Lisa can second me on this as the infectious disease doctor, the age range actually in general for viral myocarditis and Catallozzi too is really in teenagers and particularly in teenage boys. So it isn't actually surprising necessarily that that might be the age range where we're potentially seeing myocarditis from the vaccine. And so we actually would not expect really to be seeing this, much at all in the younger age groups. And, and again, that's something that they were looking for in the trial. And as Caddle said, we will also look over time. But again, just to reiterate, there is, a known risk of teenagers getting COVID, a known risk of getting COVID and getting myocarditis. And so really, when you're weighing the two, really the vaccination is really the safer choice in this, and then having a child get COVID and then have not only myocarditis but also all of the really terrible and significant cardiac outcomes that Caddle had mentioned, where child has missed and ends up in the intensive care unit, and again have these cardiac changes as well. So I think it's really important. I think that the families do remember that.
Marina and Steve, I don't know if this directly falls in your basket there, but in terms of, we were talking about helping parents understand, educating them, giving them the information that they need. Is the mental health aspect of that for parents important also, that we need to sort of massage them, if you will, to get them to understand this so that they can also protect their children? How do we handle that aspect of it?
Well, I think it's already been raised that it's important to first understand what families' concerns are, specifically about vaccination. And when I see patients and families in the office, I let them know that we actually have the COVID vaccine on site. And if they are vaccinated or unvaccinated, we can offer it to them. And then I ask what questions might they have about the vaccine. And parents will frequently share what their concerns are, what they have heard from, whether it's family members or social media, that they may be hesitant about getting a vaccine, or anxious about. And in addition, our tweens who are eligible for the vaccine may have their own concerns, whether that was because of what the family is feeling, or what their friends on social media and TikTok are saying about vaccines. So we hear everything that they're thinking and feeling and understanding before we ask if it's okay for us to share our opinion and our thoughts and our medical expertise, because we are public health experts in a sense. And given that permission, I then let them know what I know about the science behind vaccines. A lot of the questions are about why was it made so quickly, and so we talk about that. And as Melissa pointed out earlier, we've done, even before vaccines were approved for kids, we've done a lot of education with our community-based organizations and adults about vaccination, even as pediatricians. And so, we're used to sharing that information and trying to help answer questions and guide families.
Mm-hmm. And Marina, it sounds like it's important, as much of a tendency, or you might have, to dismiss some of the misinformation or crazy things that people may be hearing. I guess it's really important to listen to them, as Steve suggested, and take it seriously, because to them it is very serious. You have to listen to what they're saying. No?
There's good data out there, sort of that Steve indicated this, that both adolescents in particular and parents really want to talk to their provider. And part of the whole idea of the medical home and getting vaccinated in the medical home is that they really want to hear what their provider has to say, particularly about vaccines. This was true in HPV vaccinations, and it's true for COVID as well. And some of, Melissa and I did some qualitative research at some point looking at HPV vaccine. A lot of concerns came up around fertility, and that has happened for COVID as well. And really being able to address those. And look, you talk about RNA, people have heard about genetic material. It's easy to put things together. There's a lot of information right now where, there's a new whole lexicon that we use now that words that were not in the general vocabulary for years. There was just a great article out about this. And so really being able to say, like, really, what are your questions? Do you have worries? Here's some things I've been hearing, but really I want to know what you're worried about, can be really helpful. And I think that, again, the idea that I am willing to listen to you. And I think for providers, one important piece is, if you've talked to 5 people who have said no that day, taking a breath and being able to say, I'm still going to offer the information, right? It can be hard, but if you look at vaccine hesitancy, there's a spectrum. And there are very few individuals or families who are completely against vaccinations. And there's very few who are like, yes, I'm on board for everything. People have questions, and once questions are addressed, we usually see vaccine hesitancy decreasing. And so being able, just like you're saying, to really listen and say, like, okay, not sure where this came from. The most important thing is, here's what I can tell you about it, and here are the facts.
I can tell you where it came from. It came from social media.
And
Lisa, let me give, I want to give a heads up to our panelists, because I always do this, but I neglected to do it at the very beginning. I always want each of you to give me very brief being the operative word, a little pearl of wisdom, a take-home nugget that we want our viewers and listeners and webinarists to remember from tonight. Okay, so I'm giving you a heads up with that. But Lisa, let me just start, not ask you that, but is there a place that we can send parents and pediatricians to debunk, if you will, some of this misinformation? There's so much out there, and it's hard to find a really good place for that. Is there some place we can send them?
Yeah, I'm going to talk about the CDC website, and then I'm going to ask Steve to talk about the American Academy of Pediatrics, because he's so involved. And the CDC website is fantastic. I myself look at it literally every day. And I look at it to see the doctor side, the provider side, but I also look at it to see how that information is being translated for non-medical personnel. Just like Marina said, it's a brand new vocabulary. It's a foreign language. And medical literacy needs to be elevated to help people understand. So I highly advocate for the CDC website. It's very, very easy to negotiate. And it's like, you just Google the words you want to put together, and you'll find extremely good information.
Okay, good. We're running out of time, but Lisa or Steve, Lisa threw it to you. So what do you have to add to that?
Yeah, thank you. I'll just add that, the AAP, for people who are members of the AAP, has a lot of information on COVID-19 and the management, including questions that may come up from families and parents. But I will also add that their website, which is healthychildren.org, is an excellent website for pediatricians, but families specifically, who have questions not just about COVID-19, but about, how do you take care of a newborn? How do you raise a child? What do you need to know? That is an excellent website for information from a trusted source. So that's what I would add.
Great, good. All right, let's go to our little pearl of wisdom routine here. And I'm just going to go across the screen here in order. So unfortunately, Marina, that means you're up first. What would you like people to remember about tonight?
I think that whether you're a provider, an educator, a parent, an aunt, whatever it is, recognize that there are fears and stressors, and ask. And if you have something you're concerned about, act on it. We don't have the opportunity to sit on kids' mental health and stress, and it's better to be careful and to be transparent about it.
Kanwal, you're up next.
I guess I kind of am mimicking what Marina is saying, but for the heart. So, you know, again, I would encourage parents who are feeling like something is a little off. You know, that means either their child is not being as active as usual, is having some difficulty breathing, or is having just fatigue out of proportion to their activity, to have them see their pediatrician, who would then refer on to a cardiologist to be evaluated. Because again, I have a lot of parents coming in and their children had COVID, and they've been bringing them in because they say, well, she's not keeping up as much as she used to. And I really think that's the right way to go, especially since we're just learning about the potential long-term effects of this disease.
There is help out there, and it's okay to ask for it, right? Good, good, good. Lisa, you are up now. Tell us what you want people to remember.
I want people to know that there is an incredibly wonderful, strong, robust safety monitoring system in place to really monitor the safety and health of people after they're getting vaccinated. And that is going to happen when we start to vaccinate this 5 to 11-year-old group. And so we're going to learn so much together, and to really recognize that we've been able to see over a sustained period of time how safe the vaccines really are.
Steve, talk to me.
Thanks. I will add that, again, it's really important to continue having conversations with our families and our patients in the office, not just about, vaccine concerns, but about, what's going on with their families and related to COVID, who's been sick, who's not been sick, who's had losses that we may need to address and talk to about for the kids and the parents. And also thinking about what's going on in schools, finding out what the kids are doing, how they're being managed as far as, are they getting random surveillance testing? Are they being seated, apart from other kids? I'm learning so much from kids about what's going on in their schools just by asking those questions. So I think that's important. And they're very happy and eager to talk about it.
Good, good, good. So Melissa, tell me a little bit what your pearl of wisdom is, including, is there a way to minimize these perceived side effects when we finally get around to vaccinating children?
Sure. I think my pearl of wisdom is going to be vaccine related. So I'm going to say, if you're an adult who's watching who hasn't yet been vaccinated, then I really so strongly encourage you to get vaccinated. And if you're the parent or the loved one of a child, again, who's age eligible or almost to be, really to be vaccinated as well. And I think for the pediatricians who are out there, really leading into these conversations and looking at the resources, CDC or AAP, or maybe you've learned some things today. We all know, and we all have stories of families who were really unsure at first, and through kind of those discussions and that support, really felt comfortable vaccinating. And for those who aren't pediatricians, having those conversations with friends and families and loved ones. And sometimes at the end, you have an agreement to discuss it further, and that's okay too. So if someone's not quite ready yet, opening the door to having those further discussions are really important. And then I think again for the, and then I guess that's the answer to the kind of misperceptions, is really, talk to a trusted person. If you have questions, it's totally normal to have questions. There's a lot of misinformation out there, and there's a lot of really good information out there. And talking to your pediatrician or talking to, a trusted friend and getting that information really is the best way for families to make an informed decision.
Very good. Thank you. Thank you. I want to thank all of our panelists for just a terrific amount of information. I hope we managed to answer most of your questions. I'm sure we didn't get to all of them. The bottom line is there's a lot of help and there's a lot of information out there that we have for you. A reminder that this entire video will be posted by tomorrow on the Columbia Children's Health YouTube channel. So you can go back and refer to some of the things that, that we covered tonight. And my little pearl or pearls of wisdom is, I heard this said by a public health authority probably earlier this week, that this pandemic has become the pandemic of the unvaccinated. And it has also become a pandemic of the unmasked. So I can't believe that 2 years almost going into this pandemic that we've been doing these webinars, I can't believe that I still have to say, get your shot and please wear a mask. Thank you. Stay healthy. Be well. Good night.